Hello, thank you for joining us for Unite for Site's webinar about Essentials of Innovation, How to Successfully and Responsibly Innovate. My name is Jennifer Staple-Clark, and I'm founder and Chief Executive Officer of Unite for Site. I'll briefly introduce you to Unite for Site, review the webinar logistics, and then we'll hear from our expert panelists. Unite for Site is a global health nonprofit organization that promotes high-quality care for all. We offer extensive global health and social entrepreneurship education programs. Our Global Health University program, for example, offers a free webinar series, including today's webinar. And we also offer 20 online certificate programs for students and professionals. Many students receive academic credit for completion of our certificates, and professionals also utilize the programs for professional development as well. The certificate topics range from a certificate in global health and a certificate in global health research to a certificate in social entrepreneurship. We have 2 additional upcoming webinars coming up in April. The first will be on April 16th, be about how to best prepare for a career in global health. And the second will be on April 30th and will be about marketing and communicating to engage your audience. And we encourage you to register for these free upcoming webinars as well at uniteforsite.org/webinars. Additional educational opportunities for students and professionals include participation in Unite for Site's annual Global Health and Social Entrepreneurship events, which focus on responsible global engagement. Our 12th annual Global Health and Innovation Conference, which is the world's largest global health and social entrepreneurship conference, will be in just about 3 weeks on March 28th and 29th, 2015 at Yale University. And the Global Health and Innovation Conference this year newly includes a GHIC Innovation Prize, which is a $10,000 and a $5,000 cash prize that's awarded to the 2 best social entrepreneurship pitches that are presented at the 2015 conference. And both students and professionals, as well as nonprofit and for-profit organizations, are eligible to apply for the GHIC Innovation Prize. And the Innovation Prize supports outstanding early stage and startup ideas, programs, and organizations which are locally developed and locally responsible. We also have healthcare delivery programs which provide care to patients living in extreme poverty. And we partner with phenomenal local eye clinics in Ghana, Honduras, and India to provide quality eye care to patients who are otherwise unable to access or afford care. And these programs are locally led and locally managed by the local medical professionals. And our collaboration has provided eye care to more than 1.9 million people by local doctors during the past decade, including almost 90,000 sight-restoring surgeries by the local ophthalmologists. Unite for Sight is also the world's only organization that is a healthcare delivery organization that also offers global health education and social entrepreneurship opportunities for students and professionals. Participants support and learn from the local doctors in Ghana, Honduras, and India as they provide care to patients living in extreme poverty in villages, slums, and refugee camps. And participants learn from the local medical professionals about patient barriers to care and about effective strategies to reach the hardest to reach patients who are otherwise unable to access or afford care. And the local doctors are incredible social entrepreneurs who design effective and innovative strategies to eliminate barriers to care for the patients in their communities. Now I'll describe for you the basic logistics of this webinar. We're so delighted to have all of you with us today. We have 4 amazing panelists, and they have a wealth of expertise to share with you during this next hour. We were supposed to have 5 panelists today, but unfortunately Eve Blossom, who is founder of Weave, came down today with the flu and therefore isn't available to participate today. Each of our other panelists, the 4 panelists today, will give a 2-minute introduction about themselves, their current role, and their key piece of guidance regarding successfully and responsibly innovating. And then we'll dedicate the remaining time to your questions and answers. We received many stellar questions already submitted from you, our audience, by Tuesday's question submission deadline. We've selected the most common and most thoughtful questions to ask our panelists. And we also invite you to submit additional questions in the text box on the left of your webinar screen. And then we'll select additional questions to ask today's panelists as well. We also encourage you to tweet about the webinar, including your key lessons learned, by using the hashtag GHUWebinar. and you can see the hashtag in the webinar visuals on your screen. We'll proceed now with having each of our panelists introduce themselves in alphabetical order. I'm delighted to introduce you to our first panelist, Cal Bruns. Cal, please begin by introducing yourself, your background and current role, and please share your key guidance about how to successfully and responsibly innovate.
Thanks, Jennifer. Hi, everybody. My name is Cal Bruns. I'm an American. I live in Cape now. I grew up in Kansas and spent about 20 years traveling around the world producing advertising for brands and companies. And that was my background. Career, including shooting commercials with Tony and Ridley Scott, which has to be a highlight. When I arrived in South Africa, I started the company that is called Matchboxology because I was frustrated by the huge gap between development and branding. I saw that corporate social responsibility had the opportunity to be so much more. The development world's behavior change strategies and communications was kind of in that same boat. In the interim, in the last decade, I've done a lot of really interesting BCC work in HIV and tuberculosis prevention and care in Southern Africa for all the aspects. And interestingly enough, some innovative work for Levi's, the guys who make your jeans. And recently, we've been consulting with a lot of enterprises in Kenya and Ethiopia to efficiently generate greater impact using innovation and better communication. And I guess the tip to start out today by saying is that what we've learned in our first decade at Matchboxology is the most successful innovation by sharing what it's really like to do to both your colleagues and your audience. You got to understand not only what motivates people, but what attitudes, live behaviors, and what barriers. So I guess you could take all that 30 years of expertise and boil it down to one tip: nurture exceptional empathy.
Wonderful. Thank you so much, Cal. And Paul Ellingstad, if you can please introduce yourself as well.
Hi, thanks, Jennifer, and delighted to be joining everyone for the webinar tonight. So as Jennifer had mentioned, and you see on the slide there, my role is Director of Human Progress at HP. In, I suppose, a little bit plainer language, so our global citizen or our corporate citizenship functions sit within corporate affairs, but I say it's partly tongue-in-cheek, but seriously as well, that I probably have the best job within HP, that I get an opportunity to work with extraordinary NGOs and governments on social impact projects and partnerships, and really have the opportunity to draw on and coordinate all of the resources across HP, from business units, from technical and engineering functions, right through to marketing and HR and supply chain and other, operational areas as well. And so it's a really exciting opportunity to see how you can, pull together so many diverse skills and talents and capability to really roll up the sleeves and understand social problems and then apply, the necessary resources and contribute in a broader ecosystem. So I suppose, a little bit quickly on the background. So I grew up in South Dakota and always was very excited about the opportunity to see the world and learn about different cultures. And I suppose sort of the joke at the time was that I should have either joined the Navy or the Peace Corps. I had never really expected that, joining, the corporate setting, that I'd have the opportunities that I do today. In terms of the advice around innovation, I couldn't agree more with what Cal said. Maybe adding to that, I think that innovation is really about it's a change management process. And there's probably 5 things within that I try to keep in mind, and use as guidance, and it's worked relatively well so far. Innovation is about doing, it's about experimenting, and consequently within experimentation, you have to expect failure. But through the failure, it's also about, how do you learn, from the failures and then improve upon those? So it's really within the context of those 5 things, the doing, the experimenting, failing, learning, and improving. It's how you manage this change process, within an ecosystem of many different stakeholders and many different players.
Excellent. Thank you, Paul. And our next panelist, Rohit Naimpally, if you can also please introduce yourself.
Hi, Jennifer. Thanks very much, and thanks everyone for having me. So as Jennifer mentioned, my name is Rohit Naimpally. I work as a senior training associate at the Abdul, Latif, Jameel Poverty Action Lab here at the Massachusetts Institute of Technology. So what I primarily do is I'm involved in our training and capacity building activities. We're a network of researchers, primarily economists, who do impact evaluations of social programs. And we have a 3-pronged approach to things. We have the research that we do and that our affiliates do. Then we have the policy work that our various staff do to get these research results out there and to work with policymakers to ensure that we have evidence-informed policy around the world. And finally, we have our training and capacity building activities, which is what I'm primarily involved with, because we believe that it's not just the results that are coming out of these programs that people should care about, but how these results are produced. And we work using randomized control trials, or randomized evaluations as they're also called. And we think this methodology is an incredibly powerful way of getting a handle on causal inference. For people who come from a medical or epidemiological background, this isn't too surprising, but it's still quite novel in many of the social sciences. And so that's primarily what we work on, and my role is to work on courses and training materials for people who are interested in the methodology. In terms of one tip, I think I would actually echo what Paul just said, which is to constantly evaluate and innovate, think about how we can adapt systems as we learn more about them. And something which I'm hoping to get to a little later on this webinar, hopefully, is about having a strong theory underpinning any product you're putting out there. Because I think without knowing exactly what process you expect change to be coming through, it's very hard to know what impacts you're getting, how to even measure impact.
Terrific. Thank you so much, Rohit. And our 4th panelist, Al Sommer, if you can also please introduce yourself.
So I'm Al Sommer. I'm a physician and a public health researcher. And I would guess probably my area of work is closest to the material that Rohit was talking about, although the Poverty Lab at MIT primarily works in the social sphere. I tend to work more in the medical arena and spent most of my life, and still do, doing research that will provide evidence base for making appropriate policy, and then trying to convince policymakers that they should, in fact, make those policy choices as they go through having to address a whole variety of issues, only some of which are medically concerned, and others impinge on lots of other areas. And if I have 2 bottom lines for the way I have been successful and have seen others successful, is 1, to collect sufficient data that confirms the validity of your position, so you have evidence upon which to build your argument. And that doesn't mean necessarily doing one trial once. You may have to do it over decades. And that leads to the second rule, which is you need to persevere, because if you are right and repeated data and experiments and trials indicate that you're right, doesn't mean that the rest of the world is going to necessarily adopt it immediately, and you often have to prove the same thing again and again and again. But if it's important, you shouldn't give up.
Wonderful. Thank you so much, Al. And thank you to all of our panelists. As you heard, they have a wealth of expertise and guidance to share with you today. Now we'll proceed with the question and answer session. And as mentioned, we received questions in advance from you, our audience members. And if you have additional questions, please post them in the text box on the left of your webinar screen. Our first question is for Paul. There are many global health technology ideas which are considered to be innovative, but very few ultimately come to fruition, and even fewer are successful. What are strategies to ensure that global health technology ideas come to market?
Great question. Great question, Jennifer. I think, where I'd start on that is, a quote by Maslow that if your solution is a hammer, every problem starts to look like a nail. And typically what tends to happen is that, especially in the social innovation space, but, generally speaking, it's very easy now, to bring in innovation, out into the marketplace. Into sort of a rapid prototyping scenario. And what I've personally seen many times is that, there's a lot of exuberance about the idea and about the solution, and it's brought to market, perhaps before it's ready, before even, the real sense of the problem or the challenge that the innovation is addressing is fully understood. So sort of the proverbial half-baked ideas, rushing to market in fear that, if we don't do this quick enough, someone else is going to steal our idea and, make the millions or the billions of dollars. So I think first and foremost, it's about, really understanding, what the problem is, spending the proper time doing the due diligence, talking to, prospective clients or customers or users, of the solution, understanding that. And then secondly, in terms of bringing things to market, oftentimes too, it's out there, it's prototyped, but the business model hasn't been thought through, sort of the sustainability, for growing the market, for the innovation, isn't really, thought through. It's sort of, if we build it, they will come, we'll make money, or, the users will accept this. So I think, taking your time, not rushing to market, understanding the problem, those are some of the very fundamental ways that you can increase the probability of long-term success with an innovation.
Terrific. Thank you so much, Paul. And Al, how should we best teach and encourage responsible innovation to students and young professionals?
Well, I spend most of my time at the Hopkins Bloomberg School of Public Health doing exactly that, as do many of the faculty. And I would say the thing we try and impress upon people is you have to understand the problem. You have to understand what are the underlying causes of the problem. You have to certainly review the literature and understand what other people have thought and tried to do about it in the past, because the last thing you want to do is reinvent the wheel. And then you have to, and the most innovative part is thinking about how can you, in fact, identify a new approach that will more effectively and efficiently solve a problem, so that it can then be told to others and sold to others in a way that it brings to scale. I hope when people are listening to this, they realize the four of us are coming from very different perspectives. I'm not marketing to people who want to buy something. So I would make the analogy that if you make something that's really sexy and it appeals to people, like iPhones, that's marketing to people because it's something that they want or didn't know that they wanted, that you've created so that now they want something that they didn't even know about. My issues, while facing the same problems, are usually about things that, in fact, people would don't know how to solve, and they're sort of more heart-wrenching and life enabling than are traditional things when you're looking for venture capital in order to sell to a larger market.
Wonderful. Thank you so much, Al. And Paul, what is a good way to thoroughly research a field to know if your innovation or something like it has been tried before? And does it matter if something similar has been done in some capacity?
So starting with, does it matter if something has been done? No, I don't think it does. I think part of innovation is, the ability to constantly improve, and many times, innovation is not about something that's just so completely new. No one's thought about it before. No one's seen it before. It's continuing to make significant progress or innovation within solutions that are already available as well. In terms of the due diligence, though, boy, this again it's one that sometimes I find it surprising at the lack of due diligence. And again, it's sort of this exuberance of I've got an idea, individuals as well as organizations, and sometimes within an organization, you can even get that sort of, wow, a great idea. Why didn't anyone think about it before? And it's again, rushing out to market. So again, starting with just a very, basic research methodology of a scan, even sometimes I'd say something as basic as, Googling the idea that you have, under a number of different search terms, to see what's already out there. Secondly, though, I think as well, there's perhaps sort of a paranoia or an insecurity of, we've got a great idea, we want to get it to market, we want to be the first ones out there. And so, again, there isn't sort of the openness of reaching out to prospective, clients or users or beneficiaries, of the solution or of the innovation, talking to others that, that would be customers, and even, quite frankly, being able to talk to, potential partners or even potential competitors, to get a sense. You can still talk about sort of the problem, and from that understand, what has been tried before to address the problem without sort of giving away your killer innovation, but talking to others in the marketplace, from the customers to even prospective competitors, can be a very straightforward way to, to really do the proper due diligence.
Jennifer, can I make this a conversation?
Yes, that sounds excellent.
Okay, so let me pick up on that. So in my sphere of operation, or at least actually to begin with what Paul just said, everybody knows, I think, or should know, that the fax, which hardly anybody uses anymore, but once was revolutionary, was developed in the U.S. by U.S. companies, but never commercialized. It was commercialized by the Japanese. So someone had done it before, but nobody ran with the ball. The same story is about the mouse. The mouse for your computer was not invented by Apple, but it was Steve Jobs who saw one and said, gee, this really has commercial value. So the fact that it's been done before doesn't mean that there isn't a lot of room to run with it. In my own sphere of activity, and one of my major research issues over the years has been vitamin A deficiency, and one of the specific diseases is a high mortality rate in children these days, particularly in the developing world, from measles. Well, in fact, we went ahead and did this randomized trial that showed you take these kids and they happen to be vitamin A deficient, and you give them one dose of vitamin A and reduce their case fatality rate for measles by half. Now, somewhat embarrassingly, after we published that data, which turned out to be true and other people have replicated it, we discovered that 60 years earlier, that essentially same experiment had been done in London, England. They didn't have pure vitamin A then, so they used cod liver oil, which is rich in vitamin A. But nobody believed it, and the person who did the work just simply moved on to something else. So he had the right idea, he had the evidence, and because that one study did not convince the world, it didn't change clinical practice or policy, and so you got to go back and do it again, do it again, do it again, and perseverance is a critical part of, I think, any successful innovation. You can sit in your lab, as Paul was suggesting, and come up with something, but if you haven't convinced anyone, it's not going to do anybody any good. If it's a useful product, whether it's for health or whether it's something you're going to sell in the marketplace, you got to keep going back to it, until you convince the world that, in fact, it is a useful something to adopt.
That's excellent. Thank you so much, both Paul and Al, on those excellent comments. Do any of our other panelists have anything additional to add? Otherwise, we can move along to the next question. Okay, so another question actually for Cal. What are strategies for bringing ideas to market where you have little expertise or networking?
I think this is a great question, because so many of the innovations come from people, the marketers. They're brilliant scientists or inventors, but they have no sense for how to commercialize something, how to take a product and roll it out. And there are two kind of tips that I'd like to give people like that. The first is recognize your limitations and partner with people who are good at that kind of thing. To pick up on one thing, this perseverance is brilliant, but if you find yourself, your Achilles heel is that you just don't know how to convince the world of something, go find someone who can help you. And I think Paul was suggesting a great strategy, which is go out and talk to people about what are the barriers, why did your idea fail, why is this one failing? Really begin to understand, how to get into a market. That can work if you're, a clever marketer as well. I mean, there are many multinationals that spend a huge amount of money understanding markets. And I find that on the social side, if you have a really interesting product that's going to make the world share their knowledge, it's not really at all a commercial threat to them. And they'll teach you a lot of things about how they think, what are their attitudes, what are their behaviors. And you can take that back and apply that to your strategies. Of course, it's not going to deal with so they're not going to tell you about sexual behaviors or family and gender dynamics necessarily, or the detailed kind of medical or cultural myths or practices that can pose major barriers to rollouts. But I'll give you the second tip. The best advice I can give you is go spend a bit of time in the market and talk to the people that aren't your target, people who are your target. So the taxi drivers, the bartenders, the professional musicians, the hair salon ladies. You know what? Between them and if you add in professional soccer players, you're going to know Eastern and place Africa and probably in Asia as well. They hear everyone's likes and dislikes and biases and opinions, and talk to a few people to find out what a whole lot of people actually think. And it's a very efficient way to get a handle on what the market is needing and how you might be able to deliver that with your innovation.
Terrific. Thank you, Cal. And Rohit, several questions for you. There are many examples of ideas which were considered innovative, but a variety of factors, including the lack of focus on evaluation and outcomes, ultimately led to the program's or organization's demise. One well-known example is PlayPumps. Can you describe how evaluation and outcomes measurement should be part of any program from the onset, and also comment on how a startup program or very small programs can successfully incorporate metrics measurements?
Certainly. Thanks, Jennifer. So PlayPumps is an interesting example. Actually, I think it's a good one in this context. So, one point that people often raise when we talk about randomized evaluations that, say, organizations like JPAL do is that not everything it's not feasible to evaluate everything, right? So a classic example is, how would you evaluate a big macroeconomic policy, or how do you evaluate something that's already been rolled out? Sometimes it might not be logistically possible. Sometimes it might not be ethically possible. There are various reasons why you can't. But that doesn't mean you can't do anything at all. I go back to Dean Carlin's keynote at the United Site conference in December, actually, where he talked about the Goldilocks problem, which many organizations face. How much data should we collect? What data should we collect? And the point is, if your program, I think, is or your product is informed by a strong theory and a strong process, you should be collecting data and making sure that you're monitoring the process and that at every step of the way you're doing what you do. So let's take the example, let's say something like PlayPumps, right? What is the theory of change there? Say the problem you're trying to identify is that people don't have enough clean water. Well, the PlayPumps might be addressing might be addressing an issue of access, say. But if people are then taking that water and transferring them to containers that then contaminate the water, you might still not be getting people clean water. or if the issue is that it addresses a very specific problem, right? How do we get water out of the ground with the labor at hand? That might not be the primary problem. That might not be the only problem. And if we have time a little later, I'd like to raise an example of another idea which initially people were very excited about, but then once you think about the theory, it's clear that it might not always work with certain small fixes. So I think having a theory that underpinning anything you do is critical there, right? And then gathering data and monitoring at every step of the way. So say we have an intervention that's trying to get people clean water, monitoring at every step of the way what's going right, where could things be going wrong if something's going wrong. You might not be rigorously evaluating it in terms of a randomized evaluation, but you still could be collecting exceptional data and doing a very, very rigorous qualitative process tracing to make sure that you're doing what you say you're doing. So say you're trying to provide clean water to people and you find that ultimately there isn't any decrease in waterborne diseases, it might not be that people don't have access to the clean water. They just, at somewhere else along the way, something might be breaking down. People might be transporting the water in contaminated containers, or it might be getting contaminated elsewhere. So I think building these monitoring processes in is critical, and that's where every organization or any innovator can stand to evaluate what they're doing.
Great. Thank you, Rohit. And as a follow-up question, are there other examples besides PlayPumps which were initially considered innovative ideas and generated significant funding support but then failed, and what should they have done differently?
Okay, so this is a slightly, I don't want to sort of rail on any program, but I can't talk of an example of an idea that initially generated tremendous enthusiasm, and we've had to temper it a little bit, right? So one idea that generated a lot of enthusiasm, say, in the economics community, is the idea of providing, say, farmers or fishermen or people who otherwise work through intermediaries to distribute products, or typically agricultural products, with price information, because you see these massive dispersion in prices, right? People aren't getting market prices, farm gate prices are much lower than wholesale prices, and so on. And so just trying to figure out a way by which you can ensure that the producers of, say, agricultural products are getting the prices that they deserve. And one idea people were excited about was, well, say maybe with the advent of information communication technology, where everyone has a cell phone, you're cutting through these information asymmetries that exist, and that would reduce these price dispersions, which sounds great in theory. So there's a lot of funding that's gone into the spread of ICT technology, the spread of, say, mobile phones, or there was one program in India where they set up these internet kiosks where farmers could go and check prices. And now there's a fairly large body of evidence, both from randomized evaluations and from non-randomized evaluations, to show that while these price dispersions do decrease, so providing, say, farmers with information on what sorts of prices they could be receiving or what the prices are in their area, while that does decrease this price dispersion, it doesn't do it by much. And what's critical here is to think about the markets that are what the structure of the markets is, right? So you could tell me that I could, in theory, be getting a lot more than I'm getting for the products that I'm selling. But if I have no way of getting it to the market, so I have to operate through an intermediary or a trader, it might not work. So again, this just goes back to the point I was making earlier about having a strong theory underpinning your process. If you think the problem is purely one of information, then an idea like, providing information either through spreading mobile phones or internet kiosks or just giving people access to this information is great. But if there is another barrier at play, it might not be the only way to. You might not get at the problems through nature. So again, I think what could maybe be done differently is to think about, in addition to providing information, how do we sort of break these market barriers? How do we break the hold intermediaries have? Or maybe another way to approach this: how do we make it easier for people to get to markets and provide these prices so they can actually get any benefits that accrue from downstream price upticks in price?
I would think, in a more generic sense, problem is one often doesn't understand or take the time to understand, all the issues that are involved in providing a solution. So to give you examples you will know about from current day work, the polio eradication program, we hope will be successful, but one had not anticipated it would become a political issue in Nigeria, from which it could then go be re-exported again as a disease, or Pakistan or Afghanistan, while one could hardly believe that India could rid itself of polio, and it did. So there it was pretty much understood, but things came along that ruined the original assumptions. Smallpox eradication, which was the model, succeeded largely because not only people were really compelled to do it, but the underlying assumptions were about 85% correct. But they kept monitoring and experimenting with alternatives, so they ended up with a better vaccine than they started, one that could withstand heat better in transport and supply chains, and a whole different strategy. The original strategy of the smallpox eradication program had been, if we vaccinate everyone in the world, there'll be no more smallpox. The problem is you can never vaccinate everyone in the world. And when they came to that realization, they came up with a new strategy, which was, let's focus our resources entirely on people who have smallpox and anyone who's been in contact with them. And by experimenting, measuring and experimenting as they went along, they were able to do that. The antithesis of all of that was the malaria eradication program, where, coming on the heels of what looked like was going to be a successful smallpox program, a much more complicated disease process was undertaken with very simplistic assumptions, because all you need is one or two mosquitoes to remain around and be resistant to insecticides, and then they repopulate the area and the malaria spreads again. So often the problem is simply, number one, not understanding all the issues that are going to come to play, and two, you know that Uncle Murphy is always going to be around, so there will always be new issues you haven't thought of. You have to be on the lookout for them, and you have to be experimenting with ways to get around them.
That's wonderful. Thank you so much. And Al, another question along the same lines. For those engaged in outcomes measurements or research in resource-poor settings, how can one ensure that the data collection and evaluation process is locally responsible and ethical?
Well, you know, Jennifer, as you point out, number one, it has to be ethical, and it has to be culturally acceptable, because if it's not, one, people are not going to participate, and two, you're not in a good space. So what we always do, and you know, early on we were actually creating IRBs, institutional review boards, locally in countries that never had them. Because if you're going to go and do a clinical trial or any research in the medical sphere, it has to be acceptable to the local authorities, and people have to understand what they are participating in. And so we always, in some places, we really did for countries have to educate them on how to do an IRB process so they could approve it, in addition to approving it at our own home institutions. And then, of course, you've got to engage thought leaders and local political leaders and cultural icons to be sure that you understand what's culturally appropriate. And if it's something very different from what that culture is, are there ways to make it culturally appropriate or done in ways that people will understand and will accept? And it can be a very long and detailed process, but if you don't do it, for sure you're going to set yourself up for, at worst, failure, but even in the way, lots of misunderstandings, which you could certainly do without. So you involve local experts, you create institutions that you can react with and can work with you to successfully carry something out. And if you don't do that, you're going to find yourself in a hard place. But you do have to create metrics that are meaningful, because if you don't, then you're not going to be able to convince anybody of the importance of adopting a policy which may be perfectly appropriate and right on its face value, but if the data aren't there, then it's going to be very hard to convince anyone.
Great. Thank you so much, Al. And Paul, local context is always critical, as we've all been discussing. What can the public and funders do to identify whether a program or innovation is locally responsible?
It's a great question, Jennifer. I think, building on, what I'm hearing is a very, sort of a consistent theme about, spending time, in country or in market, understanding the dynamics of, both sort of the users as well as other, other players in the ecosystem. Whether you're a funder or any other sort of stakeholder, I think number one is sort of the transparency of, who's working within the solution. Is it clear, what the model is, who is paying for it? If it is, for fee, service or solution, particularly in the health space as well. What I have seen though too is that, the sort of the traditional, what we'd call like the barriers to entry, if you're talking about sort of commercial entry, to a market with a new solution or a new product, you don't have the same sort of regulation, the same sort of barriers in many of the, the social impact spaces. And so what I mean by that is that it would be very easy for an NGO to sort of come in and set up shop and start, delivering a health service. One of the things that we've seen in that is that, it's really vital to sort of understand, is the government aware? Is there, some sort of, acknowledgement and endorsement? One example of this in Uganda a number of years ago, it got to the point that there were so many quote unquote, pilot projects going on that the government just, called a halt, to any further, pilots to be deployed in Uganda. There were something, I believe, if I recall the statistics correctly, something like over 450, various pilots, that had different levels of acknowledgement from the government, but really there was no sort of, coordination or understanding of the scope, the impact, any of the, the consequences. So, that's a good sign in and of itself of, who are the players, what sort of official, endorsement or acknowledgement, of the local government and other players. The other thing too is, and this applies the same as being successful in innovation, is I think as funders, don't just sort of take the word of the organizations, go and do the site inspection, see what's happening, in market with the beneficiaries, with the other partners in that as well.
Excellent. Thank you, Paul. And Al, how can credibility be established when a program or research result is completely novel? How can one still establish an evidence basis for the program or research?
Well, I think, it goes back to being sure you've done your homework to begin with. Can you explain the problem in a way that policymakers and those who have to give you permission or those who have to fund the project are willing to understand it? Then you have to give the evidence, and it may be pretty remote, it may be fairly simple and not very supportive, but some evidence that this is just not an idea I dreamt up in the middle of the night, but there is some reason why this might be a way to begin to impact on an issue. And usually if it really is very innovative, at least in the health space, you usually have to begin with a pilot project, something small. Because I had a great idea about, how to control polio, doesn't mean that it's going to be successful and the world ought to join in with me. I have to be able to show that I can do it in a small, more contained environment and area, and then you build upon that as you do that. In the vitamin A story, for example, we had an original observation that we were not anticipating, and nobody believed that, in fact, children who had better vitamin A status had much lower mortality than other children living side by side in a poor areas of the world. I mean, absolutely nobody would accept that. And we then went ahead and showed that if we improved the vitamin A status very inexpensively, 2 cents worth of vitamin A twice a year, we could reduce mortality by a third. Well, then nobody believed that because that was just ridiculous. How for 2 or 4 cents could you change a child's risk of death by a third to a half? So we had to do a second trial and a third trial and a fourth trial and a fifth trial, all in different places, all in different countries, all with local participants, all with local partners as leaders in the projects. And then that built a momentum that came from an unexpected observation to an intervention that nobody believed could possibly be true to a global policy. So a lot of these things have to be done incrementally, particularly when they are not on anybody's, sort of in their eyesight to begin with. It's not on the table, and it really seems to be far afield. It's an incremental process, and again, goes back to persevering. And I don't mean persevering by just doing the same thing over and over and over again. I mean persevering by creating more data, giving more talks, getting more people involved, getting more organizations, particularly ones that have international credibility for excellence, to become involved with the project, writing more editorials, writing more articles. If you're going to make a big difference in the world of changing global policy, which means government policy, not individual behaviors of individuals, which is another issue entirely, you're going to have to come to it knowing that it's going to be a long effort.
Great. Thank you, Al. And Cal, what are the most successful strategies for behavior change in healthcare delivery?
Thank you. And I hope my connection is okay. I apologize to those that are having trouble hearing me. We've had a lot of wildfires here. Good. Okay, I'll carry on then. So I agree with a lot of what's been said earlier about healthcare being not just an individual challenge, but a systemic challenge. And that means behavior change needs to occur with policymakers, but also it must filter down to the managers, the doctors, the nurses, administrators, and the people who design and implement this healthcare delivery, as much as it needs to take place with the general public. I suspect in Al's case it was a lot easier to get mothers to believe that taking a bit of vitamin A for their children could protect them than it was all those people who feel obligated to protect those mothers from making bad decisions. So I think recognizing there are different levels of behavior change are important. I think, of course, there's nothing new about talking about this strategic alignment with system strengthening, but actually putting it into practice is a lot more difficult. And as Al was saying, it's a lot about perseverance and changing the behavior of experts, which is really difficult because they're experts. Of course, they know everything. I think techniques, ideas, how communication is being conveyed these days through look at how TED Talks have changed the way people present. I think they're shorter, sharper, a lot more effective, and built on storytelling, and I think that works. Evidence is critical, but evidence needs to be told by one human and make a connection with another. And I think that's a really important message when we talk about, strategies for behavior change. It's human to human, and we have to not just understand those people, but make that connection. And lastly, I think to reiterate the comment about empathy I made earlier, and it's been echoed by so many people saying, you need to understand. We forget how difficult it is to be on the ground in healthcare in developing markets. How to be a doctor who's overworked, underpaid, and underappreciated, and constantly told by outsiders, here's a better idea. What it's like to be a nurse who's just lost her passion and pride because she spent the last 10 years being underpaid and trying to be a single mother on top of it. And those policymakers who are frankly in political parties and have other agendas, often in developing markets, which are greed-based agendas. And I think to understand the complexities of those human beings and make connections and breakthroughs with them is not easy. But I think until we accept that that's the challenge, not just inventing or observing the brilliant idea, we can't get very far. So
this is Al again. I'm going to make this a conversation. I would agree with everything that Cal said, but I would emphasize, since we're talking about behavior change, people's behavior change, that it's hard to change individual people's behavior. And I think that was one of the points of the many that Cal was making. Because people don't change behavior on their own. They change behavior because of changes within the society groupings that they are, in the family and the company in which they work, the church they attend, the school they go to, and the larger sort of behavioral attributes of their culture and society. The way you can start to make some of those changes, we always start by educating people. I always tell students and younger faculty that first we tell people why they have to change their behavior so that they can understand why we're now about to screw them. And what I mean by screw them is we're going to change the environment, which starts to push people in the right direction. So if you look at what Mayor Bloomberg did in New York, and many other cities have now copied around the country, if you want people to reduce their smoking, well, you make it illegal to smoke in public places. And I don't know, was it the last time most people on this telephone call went to someone's home for a party? There are no longer ashtrays. We used to have parties. We didn't smoke, but we'd have ashtrays out because that was the polite thing to do for people to do. I haven't gone to someone's home in 15 or 20 years where there's been any ashtrays out. You increase taxes on tobacco products, so that makes it more difficult for young people. Adolescence is where people usually start smoking. That's when they experiment, and if they get hooked on nicotine, that's when they get hooked. You make it a little bit more expensive. So you change the environment that starts to push people towards a more appropriate, healthier behavior. One of the bad things that's happened in the United States, other than just fast food, which is unhealthy, is portion sizes. So I don't know how many of you, but when I was growing up, my generation was always taught you have to finish everything on your plate. Well, that may have been okay because our plates weren't so full of food in those days. Now restaurants, and particularly fast food places, they compete on how much food is on your plate. And I watch these portions of food coming to people who, if they are compelled like I am to finish anything on my plate, would quickly explain why two-thirds of Americans are obese or overweight. And that's the same epidemic that's going around the world. So changing people's behavior individually is hard, but changing the environment in which they operate can help to push them in the right direction.
Excellent. Excellent insight from both Al and Cal. Thank you. And another question from Cal. What strategies do you find to be most effective when incorporating stories into marketing and enterprise?
That's a good question, eh? Telling is very effective as a mass media tool. It's also very effective as a one-on-one tool when you enable people, I think, to make the point as part of the story. Not many people are great storytellers, and I think that's the challenge. What I often experience in our work is clients and funders are really wanting the solutions to come from the group of people that they're trying to work with. So there's lots and lots of engagement. The engagement works really well for insight, but when it comes to actually doing the storytelling, you need professionals, you need experts, you need people that can enthrall you and engage you and entertain you. Not everybody can stand on a stage and be a good actor or be on television or be in movies. That's a skill set that few of us have. I think. And I guess the biggest strategic insight I can give is to recognize when you need those people on your side. Go and recruit them. You'll discover quickly how often they become huge champions of your cause and will give you what you need. But to Al's point, and I think the point that Paul made earlier, education is key. Every one of those great storytellers is a person. So start off by teaching them, and then they'll help you teach lots of people with their skill set.
Terrific. Thank you, Cal. And the final question for all of our panelists, can you comment on what strategies you or your organization used which you can pinpoint as enabling you to successfully change the landscape of your field? And we can go in reverse alphabetical order this time. If Al, you can please start.
Okay, let me do this quickly because I know we're running out of time. Assuming you have the evidence, then you start involving individuals and organizations that have a trusted name. So we would involve trusted organizations, like WHO, UNICEF, CDC, opinion leaders, people and organizations who can make a difference, and be sure that the issues that you're going to take on are ones that are critical and resonate, and sometimes you don't even understand that. So again, going back to the vitamin A story, our first observation that we could demonstrate was that 2 cents worth of vitamin A year could prevent 500,000 children in Asia and Africa from going blind. And I could not interest a single minister in health in doing something about that, because their answer was, look, Al, we have $2 a year to spend on the whole health care delivery to children in our countries. Where would you like us to take the money from? Should we take it away from child survival programs, from immunization and related things? And, they're in a tough spot. I understood that. When we then made the observation that 2 cents worth of vitamin A would dramatically improve child survival, that was something that resonated with them. So sometimes you have to have a timely issue, and that can make all the difference.
Wonderful. Thank you, Al. And Rohit, if you can please share your thoughts as well.
So I think to be really boring it would be randomized evaluations, actually, just the introduction of that into evaluating social programs. And more than that, just the idea that sometimes even a little intervention, when you evaluate, you find it can have massive impact, sometimes far more than you would imagine, even much bigger, more blockbuster programs could have. So first example is deworming pills. They were being rolled out in Kenya. One of the very earliest JPAL studies, along with our partner organization, Innovations for Poverty Action, revolved around the rollout of deworming pills in Kenya. And what the researchers Michael Kremer and Ted Miguel found was that these children who received these pills a year or 2 years earlier than others had massive downstream impacts. We're talking about huge increases in income, 20% differences in monthly income and stuff, traditional programs like, say, textbooks or incentives to keep kids in school just haven't thus far replicated those kinds of impacts. So the idea that through a rigorous evaluation you might be able to identify these blockbuster programs, I think is quite cool.
Great. Thank you, Rohit. And Paul, if you can also please share your insight.
Sure. So Dan Pink has talked very often about the role of empowering employees or staff of your organization. The time and sort of the latitude to be able to pursue ideas that they have and sort of work on those and flesh them out. I think a lot of times, again, back to this idea of the importance of failure and innovation. It's trust, it's empowerment of individuals that there is no crazy idea. Get some time, work on it, pursue it, think through, the problem and possible solutions. So, even just carving out the time and saying to employees, it's okay for you to spend time, working on innovation. is, very fundamental, but, it's a real key to success that I've seen time and time again.
Great. Thank you, Paul. And our final panelist, Cal, if you can also please share your thoughts.
Well, again, the caveat comes, I'm not a scientist. So most of the people that we work with are involved in trying to assess behavior. And I can say that one of the best pieces or best strategies that we've employed is not to assume that those people actually have any idea what the problem really is. They come with observations, they come with scientific insights, but very rarely with the truth behind the problem. And that comes out only with a lot of legwork, a lot of shoe leather, a lot of people in lots of different places. And then connects that others haven't seen, even though they looked at the problem 1,000 times before. And I think Rohit hit on this a little bit, and definitely it's one we've done. Getting younger people to adopt condoms is a giant frustration around the world. It doesn't make sense that they're going to do it. We had a very forward-thinking client, Levi Strauss, and convinced them amazingly enough to allow us to put their logo on condoms. And so we gave away 1 million condoms as an experiment to see what's the difference in uptake between Levi's condoms and government's free condoms. And it was, as you might expect, people loved the Levi's condoms significantly more than the free government condoms, because all of that corporate cachet came with it, and it changed how you felt about that product. So I think there are dots to be connected by lots of people out there. And I guess to, again, reiterate Al's point of perseverance, don't stop looking,
Great. Thank you so much, Cal. And thank you to all of our panelists for your phenomenal insight today. And this brings us to the conclusion of today's webinar. Thank you so much to our panelists and to our audience.